My name is Georgios Orfaniotis. I'm a plastic surgeon working here on Harley St. Today I'm going to talk about a topic that is increasingly been asked from our patients here, and it's breast implant revision surgery. So the reasons can be medical. So patients might have implants that they have been recalled, and we had that in the past. Implants that they have an increased risk of a rare type of cancer, but also implants that have been ruptured and create a swelling, or patients that they have physical symptoms such as pain or other symptoms that might relate to the breast implants. Patients that have capsular contracture may require a revision, but most of our patients, what they want is a fresher look. The implants have been there for a long time, they have undergone some changes, same for the tissues, they lost the structure, the support. Pregnancies, weight loss can contribute to that, so there are different options to deal with this. So the first question that we need to ask is, do we want the implant to be replaced? This is a fundamental question, and there are options to deal in both cases where the implant is to be removed or replaced. The second question is, what are we doing with the volume? So do we want to go bigger, do we want to go smaller, or do we want to stay at the same sort of volume? The third question is, what are we doing with the capsule? So if there is capsular contracture, the operation can be a bit more complicated by additional capsulectomy, as we call it, which can be partial or in block. So once we answer these questions, so our options could be from a simple exchange of implant, which is just a quick operation whereby you go use the same pocket, the capsule is intact, so you go either smaller, bigger, or the same, to something more complex, and this is usually the case that I see most patients that require a more complex surgery and a number of techniques that can be combined to achieve a good result. These techniques can be a mastopexy, which will deal with the additional skin and tissue and will tighten the tissues around the implant. It can be switch of the pocket, so some patients that have very little tissue, especially on the upper pole where the implant can show, might benefit from having a switch from over to under the muscle. And what I'm increasingly offering to my patients now, and I think it's a very powerful adjunct to any revisional surgery, is fat grafting. So fat grafting, we use it a lot in breast surgery, specifically for revisions. It can help for a number of reasons. Firstly, it can give you some extra padding and improve the result in difficult areas and key areas, such as the upper pole and the cleavage. And also at the same time, due to all these factors that they contain, they help in rejuvenating the skin. Second, fat grafting can increase the volume, and in this case, we can reduce the size of the implant by adding fat. And this is beneficial because the smaller the implant, usually the less complications in the long term. And finally, fat grafting can be seen as an investment in the future. Sometimes patients might opt to have their implants removed in a few years' time. So by building up with their own tissue, this can lead to a better and improved outcome overall in the long term. So it is a broad topic, there are options for you there, and please get in touch if you have any questions or you want to consult.